Hello, my name is Roberta Clark, and I will be submitting Unit 7's assignment, Insurance Claims Processing and Training Presentation for Insurance Claims Processing and Adjudication course. Let's begin with next slide. Today's session objectives are the life cycle of a medical claim, evaluate payer remittance, payment reports, and EOBs, which are explanation of benefits, differentiate between the various types of insurances, overview of facility billing, payer's perspective of fraud, waste, and abuse, CPT, HCPCS2, and ICD, accounts receivables and collections, and biller's position on the payer side. Next slide. The life cycle of a claim, according to, unfortunately, is unknown. The life cycle of an insurance claim is the process a health insurance claim goes through from the time the claim is submitted by the provider until it is paid by the insurance carrier. There are four basic steps to the life cycle of an insurance claim: submission, processing, adjudication, and payment slash denial. Expounding on this statement is to break down the life cycle of each step. The submission cycle step is when service has been provided, it is now time to collect on reimbursement. One accomplishes this by way of sending, either electronically or via hard copy, the claim to the insurance provider, either on a weekly, biweekly, or sometimes monthly basis. Processing is the step in which the payer has received the invoice healthcare claim. This step is very important, being that you must receive confirmation of all the claims. The the payer's responsibility is to confirm that all members slash patients have been serviced. The adjudication step, claims are adjudicated. A claim adjudication speaks of the purpose of the insurer's compensation or fiscal obligation after the member patient insurance profits are pragmatic to a health claim. Also, the assurance that all services billed are covered beneficially for each member slash patient. Payment denial, payments are received by way of electronic funds transfer, also known as the EFT. Electronic clearinghouses, also known as the ECH, or a virtual credit card, also known as the VCC. It is also very important for a company to receive an electronic remittance advice, which is called the ERA. The ERA is a remittance of payment details which is needed in order to properly credit each member slash patient an insurance company is reimbursing. According to Beaton, electronic data interchange (EDI) is the process by which information and documents are shared from one entity to another. Payers use EDI to reduce the need for paper-based claim submission and to drive down administrative time and costs related to submission. Next slide. The life cycle of a claim. Here you will see the entire life cycle of the claim in which I just spoke of. Um, Providers submitting claims to a clearinghouse may or may not be sent to the payer the same day. Clearinghouses may impose separate editing prior to submitting your claims to the payer. In this diagram, the trading partner represents the entity responsible for submitting your claim. Claims sent by trading partner, claims received by EDI system and stored in mailbox directory, transaction identified A37I, A37P, or D. Claim level editing performed, acknowledgement sent to TP mailbox, and accepted claims sent to payer. Um, for the acknowledgement sent to TP mailbox, there is also a rejected claims will need to be corrected and resubmitted. This is actually a really good thing to do during submissions through clearinghouses, being that you are able to not have to wait a week, 2 weeks, or however long to receive your rejection from the insurance company. You can correct those claims right then and then resubmit through the clearinghouse. Once a file has been submitted by a trading partner, the life of a claim process cannot be interrupted. Next slide. And that differentiate between the insurances. According to NEAM, there are seven main insurances a person can have. They are one, preferred provider organization, which is also known as the PPO, health and maintenance organization, also known as the HMO, health insurance plans, point of service, POS, health insurance plans, exclusive provider organization, EPOs, health insurance plans, indemnity health insurance plans, health savings account, HSA, health insurance plans, and qualified small employer health reimbursement arrangements, also known as the QSEHRAs. I'm sure you probably won't remember that acronym. It is the responsibility of every medical biller to not only understand the insurances for each member, however, we must also know how to properly bill and receive payment for each and every claim that is submitted to every insurance company. Clean claims are something that many novice billers do not understand. The submission of a clean claim is to have all appropriate HCPCS. HCPCS is the Healthcare Common Procedure Coding System, are procedure codes. Codes, diagnosis codes, and correct payment amounts before submission, and to receive full reimbursement for that claim, hence claim. This slide, we will see the most flexible to the most affordable insurance type that a person can have: the PPO, the EPOs, the POS, and the HMO. The primary care physician will not accept this. Sometimes they'll accept the EPOs. They will definitely accept the point of service and HMO. However, we move down to in-network benefits. They accept all forms of insurance, um, as well as non-emergency out of network and emergency coverage. Moving on. Overview of facility billing. According to Solutions Medical Billing, Inc., facility billing is insurance billing for hospitals, inpatient, or outpatient clinics. This insurance billing is not the same as billing for a regular doctor or specialist. This billing is required to be submitted on UB04 forms instead of the more common CMS 1500 forms. The information required on UB04 forms is different than the information required on the CMS 1500. Depending upon the insurance company, billing on the UB04 is a requirement. However, while billing within the home care field, there are some insurances that do not have a preference. It can be either a UB04 or a HICSA 1500, which is the professional billing. It is very important for a biller to acquire experience under both institutional and professional billing. The reason for this is you become more marketable due to the fact you have hospital coding, physician coding, as well as billing and collections experience. As a biller, it is a necessary skill to know how to collect, what's the point of billing without following up, and collecting. On this slide, we have what we call the has a patient had a qualifying hospital stay, and it'll, if whatever answer you have, if it's no, the patient does not qualify for Medicare covered SNF care. If the patient was admitted with a skilled level of care, submit a no pay claim, which is a great form to understand and be able to relate to, because if you're able to answer these questions prior without having to look at this roadmap, then you're great at billing. And if you were to answer yes to that same question, is the patient's level of care skilled? And if you continue to answer yes, has the patient exhausted Part A benefits? Yes. Is the patient in a certified area of the facility? Yes. Now submit monthly covered claim, which is a great way to move forward. Next slide. Payer's perspective of fraud, waste, and abuse. According to Magellan Health, Inc., healthcare fraud is the intentional deception or misrepresentation made by an individual knowing that the misrepresentation could result in some unauthorized benefit to them or to others. The most common kind of healthcare fraud involves false statements or deliberate omission of information that is critical in the determination of authorization and payment for services. Healthcare fraud can result in significant monetary liabilities and, in some cases, subject the perpetrator to criminal prosecution. Unfortunately, the billing department tends to be the most effective when it comes to fraud. This usually occurs for a number of reasons, none of which is considered lawfully appropriate. Companies have billed for services which were never provided. Companies have increased billing by way of incorrect billing codes and falsifying patient information in order to generate more revenue. Under managed care, some patient services are prepaid. A company will commit fraud by overbilling a patient more than what was initially agreed upon by the patient and insurance provider. It would be my duty to inform the patient and his or her family what has transpired due to the greed of individuals who are no longer employed by the company. As a billing company, you must understand that the patient and their families are entrusting us with their personal information, and it is our obligation to ensure that we do not disrespect that trust. Next slide. Definition of fraud and abuse. Fraud is when someone intentionally executes or attempts to execute a scheme to obtain money or property of any healthcare benefit program. Abuse is when healthcare providers or suppliers perform actions that directly or indirectly result in unnecessary costs to any healthcare benefit program. The primary difference between fraud and abuse is intent. Next slide. CPT, HCPCS2, and ICD. Now, this is a lot of information, so bear with me. Code sets are CPT, ICD, and HCPCS Level 2. There are specific formats and uses for each type of code, and each type of job deals with a different amount of coding. The part which most novice billers are initially confused with is the codes that are HCPCS codes. According to medicalbillingandcoding.org, major codes that Healthcare Common Procedure Coding System HCPCS, commonly pronounced HCPCS, this code set is based upon CPT. The first level of HCPCS is identical to CPT. Coders today use HCPCS codes to represent medical procedures to Medicare, Medicaid, and several other third-party payers. CMS looked at the established CPT codes and decided that they didn't need to improve upon or vary those codes. So instead, they folded all of CPT into HCPCS. When I first started billing, I had to have my billing form and my HCPCS code side by side. If you use if you use the wrong HCPCS, if you pair the wrong HCPCS and DX code, you can guarantee a denial by the insurance company. If you're billing electronically, some clearinghouses will alert you before the billing is finalized, which you can clean the claim before final submission, which is extremely helpful. The importance of submission with paper coding is so the companies who are providing services can be reimbursed timely and correctly. In some cases, the insurance companies will pay, but it will be less than what was billed, all due to an incorrect code. If the company is denied, under or overpaid can leave your job in jeopardy due to incompetence. A biller slash coder must pay attention to everything billed to ensure you're using proper identifiers when submitting the to payers for reimbursement. As a former manager, I'll always stress to my subordinates that if you're not certain, then please ask. The use of codes is very tedious, however, very necessary if one desires payment. I always worked alongside my subordinates. It didn't matter if they had a month or 10 years of experience. I always had a 3-day mandatory side by side training with them. All billing is not created equal. All billers do not utilize all codes. However, all billers speak the same language. In the beginning of my training, my first question was why. It may sound like a silly question. However, I believe that that was one of the most important questions any person in any sort of training should ask. Why are we billing? Why must we bill this way? What would happen if we didn't utilize these codes? These are all very valid questions and they are extremely helpful when trying to get to the next level. You're able to express why you did something as opposed to doing something else, especially when it resulted in recouping money. Next slide. On this slide, you will see a timeline on prior to the 60s all the way up to 2014. This is the earliest I was able to locate. And as prior to the 60s, historically, providers submitted written descriptions of services and procedures. Now, HIPAA regulations highlight standard code set requirements, which became effective October 1st of 2014. HCPCS Level 1 and 2, ICD-10, PCI. So this timeline shows you how billing and coding has elevated from prior to the 60s when everyone was strictly doing paper claims and had to write out descriptions of the services and procedures, which resulted in many discrepancies. So now, it being an automated system where you're able to successfully submit proper codings for billings and receive your reimbursements in a more timely fashion. Next slide. Accounts receivables and collections. According to Roberts, accounts receivable or account AR is a term used to denote money owed to your practice for services you have rendered and billed. Any payments due from patients, payers, or other guarantors are considered AR. A goal of every practice, indeed every business, is to manage its AR to ensure that it gets paid correctly in a timely manner. An increase in AR from one period to another is often a sign that money such as copays and increasingly deductibles for those patients with high deductible health plans are not being collected upfront. Okay. Now, AR can be a lot to handle in the beginning stages of medical billing. I have provided a few tips to assist you with the transition. First tip, goal setting is extremely important in regards to accounts receivables. If you set a goal to collect at least 100% of all receivables, then make sure to follow up, make necessary corrections, and file all appeals in a timely fashion. Tip 2, ensure all member eligibility is up to date and current. Tip 3, when submitting invoices to members, ensure that the heading states it is due now. Doing this ensures that most members will promptly pay their bills on time. Step 4, ensure you are up to date on billing submission deadlines for all insurances. Cash flow was slow if you were to only bill monthly. Tip 5, for members whose accounts reflect that of a pending status via the insurance must be made a priority. Please set reminders to update those accounts. Tip 6, if a member's claim has been denied, do not simply change the code according to service. Please check the member's most current authorization and ensure that it was not a specialty service that was provided. If it was a specialty service, obtain the authorization and all notes associated with the service and proceed to email all documentation to the insurance company. And finally, tip 7, intermittently perform an aged AR description effective from the date of service in order to detect, address any gaps between date of service and date of billing. Next slide. Now, here are important medical bill of traits and skills one should have. So a great trait, I'm not going to go through every single trait, but a great trait, the top three I would say would be adaptable to all situations. Within this field, it changes drastically and unexpectedly, so be prepared. Be persistent. You may receive a denial and feel that you should just, okay, I've done everything I could, now I'm done. No, keep going. Email authorizations, CC myself on them. So if you get some pushback, I can step in and push harder, basically. And be confident. Don't allow them to just take advantage of you or just tell you anything because 9 times out of 10, they don't want to pay. It's called a reimbursement for a reason because people already provided the service. So now it's kind of like we're expendable. So you don't want them to be able to just tell you anything and you just go with it. So be confident. Now, the skills, you must be clever in this. You have to know your stuff because when you're speaking, to the insurance companies, especially when you're speaking with the insurance companies, they will try to loop you, throw you for a loop. Just say anything. No, don't allow it. Just keep going and be knowledgeable about group tasks. Understand your job. Know what is how something should be built. If you made a mistake, correct your mistake and move forward And last thing, um, understand that you must be persuasive. Must be. You have to understand that we are dealing with reimbursements. So you need to be able to persuade whomever you're speaking to, whether it be via phone or via email, that the reason why we deserve our reimbursement. Next slide. Last slide is the reference page, and that is the end of my presentation.